Good evening. I'd like to welcome you to our webinar, Friesian-Specific Health Issues, Updates and Research by Dr. Kathy Fox. My name is Jason Tice, and I am your Fauna Executive Director. Before we start our presentation, there are a few things I need to go over. On the right-hand side of your screen, maybe, there's always a technical difficulty, isn't there? On the right-hand side of your screen, there is a pesky toolbar. You can minimize the toolbar simply by clicking the orange arrow. This will allow you the opportunity to view the entire presentation. Everyone needs to be aware that you will be in listen-only mode throughout the presentation. To ask a question, simply type your question in the question box of the toolbar, raise your hand, and click Submit for the staff. This will alert the staff you have a question. We will stop periodically throughout the presentation and answer questions. Something new that we're going to try this webinar is we're trying to be interactive with the audience. So what we are going to do is if you have a question and you raise your hand, we are going to unmute you from the listen-only mode and allow you the opportunity to ask your questions. Hopefully this will work and everybody will get an opportunity to be interactive and ask your questions. Chances are we won't get to everyone's question today. If we don't get to your questions, you can always send it to the Fauna office at fauna@fauna.com and we will respond in a timely manner. Once again, I would like to thank everyone for attending this webinar. The webinar is being recorded and will be added to the Fauna webinar library and YouTube station. At this time, I would like to introduce our speaker, Dr. Kathy Fox from the Fenway Foundation for Friesian Horses. Dr. Fox graduated from Clinton High School, where she received a degree in animal science from the University of Wisconsin, River Falls, followed by a master's program at Texas A&M University. After working in the horse industry for a number of years, she attended the University of Wisconsin School of Veterinary Medicine, graduating in 1995. After a year-long equine internship at Littleton Large Animal Clinic in Littleton, Colorado, she returned to Wisconsin, got married to Lance Fox, who also happens to be a veterinarian, and went to work at Elkhorn Veterinary Clinic. Dr. Fox has been in private practice since that time, moving to New London, Wisconsin in 1999 and working for Great Lakes Veterinary Clinic in Neenah, Wisconsin, then starting her own private practice in 2006. Dr. Fox is currently with the Fenway Foundation for Friesian Horses full-time and continues her private practice on a very small scale. Dr. Fox, Lance, and 2 children live on 10 acres just outside New London with their assorted 4-legged family members. Dr. Fox currently owns 3 horses, 2 of which her daughter and her show together. At this time, I would like to travel to New London, Wisconsin, and our speaker, Dr. Fox. Dr. Fox, are you there?
I am.
Okay. Bear with me 1 second here. We'll make you the presenter. If you would just accept that invite, and then everybody will be on your screen.
All right, let me see. All right. Let me know when I've got everybody up, when you can see. Are we good?
Yep, it looks like we're good.
Okay. Well, I want to thank everybody for joining us here tonight. I'm hoping that at the end of all this, you will gain a little bit more knowledge about maybe something you already knew about, or heard something new that will get you excited or help you better understand the Friesians that live in your own backyard. I do work full-time for the Fenway Foundation for Friesian Horses. The foundation was started by Scott and Shelley Kelmhofer, and it's made up of myself, them, and Jamie Van Lin. We all have sort of assorted duties within the foundation, but we also all work together very well to promote the health and well-being of the Friesian horse. So I guess what I'd like to do in this talk is talk a little bit about what's new. So we're going to talk about things that we perhaps already know something about. I'm going to give you a little review, and then hopefully I'll present a little bit of research or a new slant on something that not only will bring you some new information, but will also give us all hope that there are a lot of really good people out there, and I mean all over the world, working hard to try to solve some of these issues we see in this breed that we all love so much. So as I go along, as Jason said, I'd like this to be very interactive. Some of the best conversations I've had in presentations I've given have been driven by people's questions. Oftentimes the questions you have are also, there's somebody else right there who's got that same question. So please feel free to speak up and get your questions answered as we move through. So let's talk a little bit about megaesophagus. This is something that in my years with the foundation is something that we discuss a lot. There are a lot of Friesian owners out there who contend with this on a daily basis. So we know that the age at onset of clinical symptoms, you have very, very young foals born that are symptomatic. Oftentimes milk running out of their nose as a nurse can be one of the first things that you see. And then you have Friesian horses who have no clinical symptoms whatsoever until much later in life, and they can come on very quickly, come on slowly, be something the horse can manage, or something that becomes life-threatening. So when this occurs, can run the gamut from a day of life to 15, 16 years of age. The most common clinical symptom that I hear of is the hypersalivation. So you feed these horses and they salivate. Oftentimes owners will report that they clean the feed buckets quite a lot. Difficulty swallowing, especially forages. Hay, pasture may be a little less of a problem, but forages can be the most difficult. Choke episodes are something that oftentimes begins to occur. It can be one isolated episode and then a duration or period of time before you get the next one. But oftentimes they're mild and infrequent and then move to a more severe episode that's difficult to resolve and get an increased frequency. So if you notice a choke episode in your Friesian horse, I always suggest that you put it on the calendar, and you not only note when it happened, but you note something about the severity, something about the time frame, whether the horse was able to resolve it on its own, or whether you had to get in there and assist the horse. Other things that we see, weight loss. As megaesophagus gets more and more difficult for a horse to contend with, it can be somewhat difficult to keep weight on them. Anxiety when it's occurring, they're stretching the neck, little bit of that, wide-eyed, sort of the deer in the headlight look sometimes, really seem to be quite stressed. Other horses, especially those that have had multiple choke episodes and are somewhat confident that they themselves can resolve them, they'll stand there and hypersalivate and stop eating and really not do too much, just keep swallowing and swallowing. Once it's resolved, they go back to eating. As the diet, if the particular horse that has megaesophagus has a dilation of the esophagus, so if you look at this picture and you can see that outpouching there just as the neck ties into the shoulder. That is a clinical symptom of the dilation that is seen in the esophagus. Interestingly enough, horses, the Friesians with megaesophagus, the vast majority of them don't have that kind of dilation of the esophagus. So it is interesting to me when these horses are scoped, which is oftentimes multiple choke episodes. A diagnostic tool that's used quite commonly is endoscopy. So you pass the scope down the nostril, down into the esophagus, and more often than not, there is not a significant outpouching or dilation of the esophagus. And oftentimes what's reported is just a laxity. Barium studies, are still done. I would say that maybe not as commonly, because as we learn more and more about this, we as veterinarians, you as owners, and the communication between all of us, we maybe don't do the barium studies quite as often, but we rely on our clinical presentation, the breed, the endoscopy, and oftentimes skip a barium study. So treatment. This is one of those, unfortunately, one of those things in which there's not simply a pill or a surgery that will fix this. Treatment becomes supportive care and what I just call good management practices. That includes things like feeding them in an elevated position. So all their food should be at or above the level of the base of their neck. Oftentimes they're fed whole pelleted feeds that are made into a mash. And sometimes it's a mash. There are a certain number of these horses that exist on more of a soup. They actually drink their grain or their that type of feed, their pelleted feed. They actually drink it instead of eat it. Some horses are able to be managed and continue on pastures, others not. And I think one of the key things for the megaesophagus horse would be the slow feed hay nets. They are, for a lot of these horses, just a lifesaver. They are allowed to nibble at and take very small quantities of a nice soft forage in at a time, and it allows them to continue to eat forage, but not necessarily choke on it. So there are a lot of good strategies out there, and while there are some commonalities, the other thing that I really stress is that, you know, nobody knows this horse better than the owner, and you have to tailor the supportive care and the management to that particular horse. So you really find what feeds work for your horse, what forages, what pasture, what height for the elevated feeding, and you work with your particular horse to manage them in the best possible way that you can, to make sure that they are able to eat and take in enough food to maintain them. You know, these horses, the other thing that's so amazing about them is I know of horses who have significant choke episodes, and not infrequently, but are out there every day doing their jobs, dressage horses, trail horses, pleasure horses. So they are still wanting to get out there and do what they're supposed to do despite having megaesophagus. So it isn't that they're not usable horses, they just need to be managed. So those are some of the things in a nutshell that we know. And megaesophagus in and of itself could be a webinar. But we're going to move through these things kind of fast. So I want to talk a little bit about what we don't know. The pathophysiology of megaesophagus. What is going on exactly with the esophagus? We're getting some clues now with some more recent work that's been done as to exactly where we think the defect is. Is the research done? No. Do we know exactly? I don't think so. But we're getting closer and closer. How is it passed on from sire and dam? What is the inheritance pattern? We know that megaesophagus has a genetic component, but what we don't know is where the problem is on the DNA, whether, you know, how many genes are involved, how it's passed on from generation to generation. And the big question for me, and I find this quite fascinating, is why are some so severely affected and others only mildly affected? I know full siblings, I know half siblings, and one will be very mild and have only infrequent mild difficulties. Others, a full sibling, will be quite debilitated by their megaesophagus. And so we end up looking at things like gene expression. Can they turn on and off the genes that are responsible? Is it about a particular gene that perhaps in some horses is expressed more frequently, stronger than the horse standing next to it with that same gene? What about the role of environment and management? And we can't forget at all about individual horse variation. So I'm as I tell my own clients in private practice, you know, we have to remember that this is a living, breathing biological system with a mind of its own. And we can't ever discount the individual variation between horses. Oops. And so the real question is, where do we go from here? Who's working on this out there, and who's going to help us solve the problem? A couple of years ago, I was in contact with a researcher at Michigan State, and he and his resident were looking at the actual makeup of the esophagus in the Friesian horse. So how does it look from beginning to end? And the goal was to look at the esophagus, look at any abnormalities, describe and define them, work towards getting that genetic test developed and tested, and pedigree analysis. So some pretty lofty goals. So what the foundation did was provide samples, both blood samples for DNA from affected and non-affected horses, as well as actual tissue samples. There was one paper published by this group, and they looked at the incidence of hypertrophy of the what we call the distal esophagus. So as the esophagus enters the stomach, they found that a certain number of these Friesian horses had muscular hypertrophy. The muscle was bigger than it should have been. And they did publish a paper on that. Here's the pictures. Dr. Comine. Cranial means towards the head. So this is a cross-section of the esophagus. Cranial, the part most towards the head, the middle of it, and the very caudal esophagus. And you can see the difference not just in the circumference, the size of it. You can see it becomes more dilated in the middle, but also that muscular hypertrophy on that distal end. This is a paper that was published just recently, last November. Utrecht and Wolvega also were looking at esophageal dysfunction in Friesian horses. And their objective was to understand the changes that occurred in the esophagus at the cellular level and compare with control horses, specifically characteristics of esophagus that are important for function. So what they were doing was saying, okay, we're going to look at the Friesians that are presenting with issues with their esophagus and look at non-Friesians and try to compare and contrast those two groups. So 18 affected Friesians, ages 2 to 26, were compared to 3 non-affected Friesians, in which the pedigrees were not closely related, and 3 warm bloods that were used for controls. And here are their conclusions. This is a very interesting paper. It said some things that we probably already knew. Megaesophagus occurs more frequently in Friesian horses than the general population. And that's something that we already knew. They found that it occurred more frequently in the first 5 years of life. So in their group studied, it was younger horses. That the dilation occurs most frequently in the portion of the esophagus that lies within the chest cavity. And again, that's not, that was somewhat to be expected. That is the portion of the esophagus that is under smooth muscle control. So when we think about the esophagus, we control roughly the upper third that allows us to swallow and push that bolus of food down the esophagus and get it started. But it hits a portion of the esophagus in which we don't have control, and smooth muscle contractions push that bolus of food down into the stomach. So what they found is that the portion of the esophagus under smooth muscle control was the portion that was most likely to be dilated. That there can be severe functional problems of the esophagus without grossly visible esophageal dilation, and I touched on that earlier. We have seen, and I have heard, of horses that has significant clinical symptoms of megaesophagus. But when they scoped those horses, really just not much going on. Looked pretty normal. This is probably one of the most interesting things they found, point number 5, that there is increased abnormal collagen found mainly in the non-dilated portion of the esophagus of affected horses, and that this abnormal collagen can be found in very young foals. suggesting that megaesophagus has a hereditary component in Friesians. This is the first concrete evidence that we have that this is a genetic disease. So while we've suspected that it was, here's some good concrete evidence to show that we're headed in the right direction. So this is my quick little bit on megaesophagus, and if there are any questions right now, this might be a good time to address those, Jason.
Okay, let's see if we've got any questions here at this point. Let's see if anybody's got their hand raised here. Let's see, I've got a hand raised from a Claudia Rayner. Claudia, I'm going to unmute you, and you can feel free to ask your question. Are you there, Claudia? No response from Claudia.
You want to just read her question? Do you have it in front of you?
There's no question in there.
Oh, okay. All right. Well, Claudia, if you want to get that question answered, either just type it in or raise your hand again. I think we're going to move on to the next topic then.
Okay, and that's the only question I had at this time. So.
Okay, great. All right, shifting gears. Many of the Friesian owners around North America, 129 approximately, probably not that many, excuse me, 129 horses from multiple owners participated in the blood reference interval study that the foundation did a few years ago. The sample collection was done in 2012, and it was a Friesian owner that prompted me to undertake this study. I had spoken with this owner about a pre-purchase exam in which the veterinarian doing the pre-purchase was quite concerned about the low red blood cell count of this horse. The horse was clinically fine, had no issues that the owner was aware of, was out doing its job, but had this low red blood cell count. And it was low enough and concerned the veterinarian enough that unfortunately the folks that were looking at the horse passed on the horse. And then it wasn't but about a week later I had another client contact me with much the same scenario, that low red blood cell count. And it got me thinking about whether that was really abnormal. So out of a question was born this study. So we collected, I contacted, was put in touch with Dr. Friedrichs at the University at Madison, and she's one of a handful of veterinarians who are very well versed in conducting what's called reference interval studies. Now, me and my ignorance, I thought, how hard can it be? We'll go out, we'll get a bunch of blood from these horses, we'll run it at some labs, and we'll see what we find. And it turned out to be much more complicated than that, so I was very grateful for all of Dr. Friedrichs and Dr. Sample's guidance, because I could not have done this without them. So we got together, formed a bunch of parameters that we needed. She got me on the straight and narrow with how this was to be done. So then we went out, myself, Scott, Jamie, and a bunch of other veterinarians around the country, and collected the blood samples in 8 short months. We collected 129 samples from 128 different horses from all over North America, including Alaska. We put all these blood samples, ran them through a lab called IDEX, and with a lot of statistical analysis, came up with some things that were quite different about the Friesian horse. Put together a paper that was accepted by the AAP for their 2013 convention. So off we went, we presented this at the convention. The scientific paper is finished. The abstract is now available online. I found it in several different sources. And the actual paper was to be published fairly quickly in a veterinary histopathology magazine journal. This information now is available, and it's used by veterinarians all over the world. I've had veterinarians from Europe, Australia, and South America contact me wanting this information. So we all did a really good thing, and we all did a really good job defining a little bit better how our Friesians are alike and different. So what did we learn? Well, we learned that Friesian horses are the same and different than the other equines out there. But as I always say, you guys already knew that. And here's the scoop. The reference labs values, which was IDEX labs in Columbus, Ohio, were appropriate for 29 of the 41 values assessed, meaning that for the Friesian horse, 29 out of 41, when you look at a lab's reference values, which what they do is they look at the blood values for all kinds of horses, all ages, and sort of pool them and then start taking statistical averages based on what they're finding in the population of horses whose blood comes to their lab. On the CBC, the complete blood count, we found that the red cell mass for the adult Friesian horse is less than what is considered to be normal for a general horse population, as measured by 3 values, which are HGB, HCT, and an RBC. So when you look at your horse's CBC, you will see those values on there. And these values are what are recommended for clinical use. From the blood chemistry, glucose and LDH were recognized as 2 components of the chemistry for which Friesian-specific values are recommended, meaning that Friesians differ statistically enough from the general horse population that we need to use our Friesian-specific values so that we interpret the blood results correctly. And where I think that is really important is that the use of Friesian-specific values for other components of the CBC and blood chemistry, it'll lead us as veterinarians and owners to be more accurate, not just when horses are sick, but also when they're healthy. We'll be able to look at a CBC on a pre-purchase exam for that clinically healthy adult Friesian and compare that value with what we're seeing for a Friesian specific and know that that horse truly is healthy. And this table just roughly shows you those values which were most important from the study to use with Friesian, to use as Friesian specific values. Now, one thing I do want to say about this table and about comparing these values that we obtained with something that you might see from your own veterinarian and their lab. These reference intervals are somewhat specific to IDEX and even more specifically to the analyzers that were used in Ohio. So we sent all the blood from all over the country to Ohio, and they were all run on that same analyzer, both for the CBC and chemistry. So you can imagine that even here in Wisconsin, my CBC and chemistries are most often run at a lab in Marshfield, Wisconsin, and I doubt very much they have the same analyzers as does IDEX. And also we have to, take into account the human being running the equipment. Sometimes there's a little bit of statistical differences that can just be man-made. But where I think this is value is the trends. And if you look at this generally and use it as a guideline, and then look at your results that you get and look at a trend, if you see on your results that your Friesian horse is tending to trend a little low on that RBC value, then that could very well be normal based on the fact that on our results, that is the trend, that they're going to run just a little bit lower. So I think it becomes a valuable tool, but you have to remember you're probably going to be comparing apples, not quite apples and oranges, but it's not going to be exactly oranges to oranges. So keep that in mind as you and your veterinarians use this, to just use it as a way to monitor trends. Here's the abstract, and this is a little bit of a preview, but this is how it's laid out and it's titled. And again, that will be, I'm assuming, available online to your veterinarian through the Veterinary Histopathology Journal here very shortly. I believe it was to be published yet early this summer. So hopefully we'll see that pop up online. And I always have to remember to put out a big thank you to all the blood study participants, because had it not been for all these people willing to have their veterinarians come out and work with us and draw blood and fill out paperwork and follow up, we couldn't have gotten this done. So I thank those owners, and of course I thank all their horses who had to endure the needle sticks to get the job done. Okay, any questions at all about that?
Let's see what I've got here. I don't have anybody's hand raised at this moment, and nobody has typed anything in. So, oh wait, here we go. Got a few questions here. They're so tiny to read. What do we, excuse me here, try to read this here. What do we search for to find this paper online?
You know, it is actually, the table now is posted on the Foundation's website, but I just, if you, it's always fun to just go on Google and type it in and see if you can find it. And if you type in Friesian blood reference interval study, it'll come up. You can find it pretty easily now. It's on IVIS and PubMed and all kinds of places. So thehorse.com also gave us a nice little shout out and put that in their AAP wrap up. So I believe you can get to it through thehorse.com as well. So it comes up pretty quickly and pretty easily.
Okay. Will there be a link posted for the papers on the blood work posted once it is available?
You know, I'll keep it updated on the Foundation website. So right now, like I said, the table is there. And then once the abstract is officially published, then yes, I will be more than happy to post that link up there as well.
Okay, that looks like that's all I've got at this time, Kathy.
Okay, so we're going to shift gears again, and we're going to talk about CPL, chronic progressive lymphedema, just abbreviated CPL. Was kind of one of those things, again, that I sort of fell into. You know, owners are the source of such great information, and they give me so many ideas and so much to think about. And it was a Friesian owner that sort of drove my curiosity about the chronic pastern dermatitis, the skin folds, the legs that were a little big, even on to, you know, some of these poor horses that had these big nodules. And you know, I started doing a little bit of looking around, and I came across Dr. Affolter's work in Clydesdales and Belgians. And so, you know, out of I got a little wild idea one day, and I emailed her. And I said, look, you know, I'm with the Fenway Foundation. We work with Friesian horses. I think what we're seeing is maybe just a little bit milder presentation of somewhat the same thing. Wondering, you know, how interested you might be in talking a little bit about Friesians. And boy, I tell you, she emailed back very quickly, and out of that was born a nice collaboration between between her lab at UC Davis and her group there and the foundation. So she gave me quite an education in CPL, and I'm going to share some of the key points with you here. CPL is viewed as quite a disabling disorder of many draft horse breeds. Belgians especially are really quite severely affected. We see it very commonly now in Gypsy Vanners, Shires, Clydesdales, and our Friesians. The clinical presentation resembles what is called primary lymphedema in humans, and I've put the little medical name for that in parentheses. I'm not even going to try to say that. In humans, lymphedema is often, for example, a secondary complication of cancer treatment, radiation therapy, where you're destroying those lymph channels that help drain the extremities, the arms, the legs. And so humans get lymphedema as a secondary complication. So we see a progressive swelling of the lower part of the legs, skin scaling and thickening, skin folds and nodules. The other thing that's a huge part of the problem is secondary bacterial and parasitic infections that just complicate and make the primary problem worse. It is a multifactorial disease. We know it has an underlying genetic component. And it's often referred to as chronic pastern dermatitis, but that may not really be a correct term. The pastern dermatitis may be the secondary symptom of the primary problem. And the cause is not as yet determined, but there's that word elastin again. We believe it to be due to an issue with elastin. So here's a couple pictures of two Friesian horses that have CPL. The the current way to diagnose CPL is clinical presentation. And in most cases, that presentation is enough, along with the breed, to say, yeah, you know, we kind of think that's what your horse has. So, you know, because many Friesians have such thick feathers, it can be somewhat difficult sometimes to really get in there and look at the skin and find those folds and see that thickening. But if you get in there and palpate the leg, take your fingers and especially go down on the back of the pasterns and feel that skin. If we think about how, say, and let's go to a light breed. Let's talk about a quarter horse, for example. When you think about how the quarter horse's legs should look, you should be able to see the structures. They should be well defined. The skin on the back of the pastern shouldn't be any thicker than the skin on the front of the pastern. And so I try to sort of keep that mental image in my head as we look at our Friesians. And granted, oftentimes they have more bone. But when we're talking about skin and skin thickness and what normal skin should be like, and what you should be able to observe and see on a Friesian horse's legs, you should be able to see the structures. You should be able to see the suspensory and see the flexor tendons and see the outline of the cannon bone and go down in the back of the pastern and feel the pastern bone under your hands through the skin. And if you find that everything feels thick, somewhat ill-defined, you get down on the back of the pasterns and you feel those folds, it's possible that your horse may in fact have CPL. Radiographs can be used to outline the soft tissue swelling in the skin folds, and it's quite dramatic. Skin scrapes and tape tests are used to identify any mite infections that can either be, sometimes mite infections are a primary problem and there is no CPL. Sometimes mites are there along with CPL. But either way, you want to identify any secondary infections and get those under control. When you have persistent infection and you're treating them and you're not getting where you need to be to clean that up, skin cultures and sensitivity testing sometimes helps. But your definitive diagnosis for CPL is a skin biopsy. And it's a two-part procedure in which you go with two different size biopsy punches. And you punch full thickness through the skin, and then you go in again and get that subcutaneous tissue. And that's what tells the true story. We have had several folks send biopsies in. We ourselves have biopsied a few horses and sent them in. It's not hard to do, and it was very worthwhile. We send them to Dr. Affolter. She stains them with some specific stains and looks at the changes in elastin to see whether or not potentially the horse is affected with CPL. To date, genetic studies have been, there's been work to try to develop those screening tests. But, you know, to date, that's been somewhat unrewarding. I'm sorry, I forgot the last little part. When I say it's about to change, this is where the Friesian horse is going to, I think, perhaps really help this research. Friesian pedigrees are so well documented. The Friesian horse, it's relatively easy compared to Belgians, for example, to look at those particular lines that are not affected with CPL and those particular lines that seem to be, and to separate those out. So when we talk about genetic testing, you try to identify where on the DNA you think the problem is, and you need those horses that you are sure are unaffected to become your control group. And the Friesian has been a great study subject for this because we not only can identify them fairly easily, but we have such great pedigree information about them that it helps us divide them more quickly and easily into groups, and it helps test the test a little bit quicker. So Dr. Affolter and her group are hot on the trail of this, and I believe that it won't be in the too distant future that we will be able to genetically test our horses and see whether or not they have CPL. But again, you know, CPL is a story of management. To successfully work with a horse that has this requires an almost daily commitment. It is somewhat labor intensive. You manage the symptoms, and it is a lifelong disease. There is no successful, to date, permanent treatment for CPL. Things that are suggested is to clip the feathers so that you can allow the skin, you can see the lesions, get the meds to the skin surface, and also really get in there and look at and see what you need to work on. You need to treat any bacterial infection that may be present. Sometimes that's done with shampooing, topical antibiotics. Sometimes the infections get severe enough where you need systemic antibiotics. Treat mites if they're present. Topical sprays, front lines, been used quite a bit and somewhat successfully. There are some other things out there being explored. So as those are explored a little bit closer, hopefully we will have some more treatment options for topical, for going at them topically for these mites. Environmental management, clean, dry surroundings, free of mites, mud, water. For CPL horses, water and moisture, it just makes things that much tougher. So these are not horses that you put out when it's particularly wet or muddy out. You do try to keep their skin as clean and dry as possible. Daily exercise is really important because if your lymphatic channels are already a little bit compromised, they rely on passive motion through muscle contraction to push fluid out of the limb and drain it up into the abdomen and out of the body. Exercise is a way for you to try to maximize the amount of passive movement of fluid out of the leg that you can if those lymphatic channels are already compromised. So daily exercise and skincare is very important. Hydrotherapy can be helpful when you've got swelling, but you do have to be sure to dry the legs. Make sure that your hoof care is very, very good. And I'm going to go one step further and say that with CPL, I think it's really important actually with any of these diseases and these things we talk about to make sure their health otherwise is the best that you can do. Because they're already contending with something, we might as well try to make sure that everything else about them is in tip-top working order. One thing that Dr. Affolter and her group are working on is what's called combined decongestive therapy and manual lymph drainage. It's a very specific series of massaging movements that are done, and then a very specific set of compression bandages put on. It is something that I have watched videos, I have seen it done. It is definitely something that I would want to go and have somebody show me how to do it because I think there's a little bit of real methodology to it that would make it work. It's quite labor intensive. Dr. Affolter's dream, I think, would be to have a team of people go out and give seminars and teach people how to do this. But, you know, maybe time is keeping her from doing that at this point. But potentially that might be something to look for in the future. Surgical intervention. You know, that has been undertaken a couple of times. I think when horses have these very, very big nodules, like you saw in the previous slide, sometimes those nodules will get golf ball size, softball size, and there is an attempt made to remove them. It has been done successfully. I think surgical intervention should be something that you save for those extreme cases. I think you can't let them get too far ahead of you. So if your horse begins to develop those nodules and you begin to see things that look like, you know, golf ball size or going to potentially become that size, that is the time to get your veterinarian really in the loop on it, and perhaps bring a veterinary surgeon in the loop on it. Because if you are going to try to do something surgically, of course, sooner rather than later will bring you a better prognosis. So we do treat a little bit of CPL up here in Wisconsin, and one thing that we have used is a cold laser. And our cold laser has got 3 different wavelengths that penetrate to different depths of the skin. So what I found the cold laser to be real beneficial for us is to heal all those little weeping wounds that seem to be a part of this. So we cold laser them 3 days a week. And for us, that has been huge in helping heal those little weeping wounds that they get not only down low in the foot on the coronary band and the pastern, but the other place you see them, back of the knees, right on that, what we call the accessory carpal bone that sticks out right on the back of the knee, and then the front of the hock. We've seen CPL horses get these wounds, these open wounds on the front of the hock that just don't want to heal. Cold laser has been very, very helpful. Topicals, we've tried a lot of them. We found some that have worked well, some that haven't. I have tried systemic drugs. I've had horses that I've had to treat with antibiotics and anti-inflammatories, both non-steroidals like Banamine and steroids like prednisolone. We've tried herbals and natural remedies, and I think between myself and all you guys out there, we probably have run the gamut. So really, the bottom line is this just names a few of the things we have tried. And what I tell people, what I recommend is they look at their environment, they get in the loop with their veterinarian, try to figure out what the biggest culprit is, what's holding your horse back from getting those wounds healed up, getting that pastern cleaned up, and work with different products based on what you think is your most, potentially your biggest problem, whether it be bacterial, fungal, mites, and get after it and tailor the therapy for you, your horse, and its environment. This is just an example of some of the compression stockings that are available. The one on the left of your screen there is one that Dr. Affolter has used. The one in the middle is just a photo that was provided to me by the company that makes the compression bandage. It's actually on one of our own horses. It's all the way to the right. So they are out there. Do I think they're helpful? You know, we've used our compression bandages on and off. We have one mare at the farm that every once in a while the leg that you see that on will get enlarged. The whole leg will get a little bit thick. Then we'll start treating her. We'll put her compression bandages on, and yes, it really seems to help her. So, you know, that's a company, EchoCrown. They send you a bunch of forms. You do a lot of specific measurements, and they tailor-make the compression bandages for your horse. So if you really struggle with those thick legs and you're really having a hard time controlling just general edema, I think they're helpful. Do they fix it? No, but they're another tool in the toolbox. And the research project that I alluded to, just a little update here. Many of the blood study participants also participated in the DNA collection for this project, and I can't thank all of you enough for doing that. Several horses, like I mentioned, also had biopsies and blood sent in for definitive diagnosis, and those horses were used in the case group for the current project. Friesians have been clinically diagnosed with this condition, so we have it. I guess the good news is Friesians don't have it and don't seem to be affected as severely as some of the other breeds, so for that we can be grateful. The genetics need to be worked out, but the project is in full swing with the researchers at UC Davis, and the DNA is currently being analyzed. They've been sending in groups. The first group of DNA samples went out very first part of May, I believe. So we should be getting some good information back on that, I hope, very soon, and we'll keep you posted. Why am I not switched? There we go. Okay, so I'm going to shift gears here a little bit. So are there any questions on CPL?
Okay, we do have several questions here. Got the first question from Lisa Musselwhite.
Okay.
Lisa, I'm unmuting you. Can you hear us? Okay, I'm going to go ahead and read her question for you. It says, and this was sent in several minutes ago, so this says, is this the same as scratches? And these look severe. Are there horses who have it mild, but it is chronic, never goes away, even with treatment and keeping the feathers clean? So I'm not quite sure what she's referring to. Maybe you do, Dr. Fox?
I do actually. You know, that idea of chronic pastern dermatitis is very interesting. And coming from, I come from a background where I, worked with all breeds of horses. And so I think about chronic pastern dermatitis or scratches. And I think about treating it in the paint horse with the white legs. And so, you go at it and you treat them, and more often than not, you can clear those legs up. And when they're cleared up, they don't have chronically thickened skin and skin folds. I mean, when you are successful in treating chronic scratches in a light breed horse, their legs look virtually normal. Now, they may have another episode of it. That's not uncommon. But you can usually get it under control and end up with normal legs. And I think that's where we differ a little bit with the Friesian. Is one, we have an extremely difficult time clearing it up. But even when we manage to get that dermatitis under control and you look at the skin, if that skin is thick and has folds, then I have to kind of go, does this horse have CPL? Is it the CPL that's a primary problem, and the chronic scratches is a secondary symptom of a primary problem? And I think that in a lot of horses, that is probably the scenario. So if you've got a horse where you're really struggling to clear it up, and you look at those pasterns and you look at those legs and they seem thickened and the skin seems thickened, then it may be that CPL is what's hanging up you being able to successfully treat and get rid of the chronic scratches. The other thing I will say is that CPL in Friesians runs the gamut from being quite mild, so some skin flaking, maybe a little thickness, but not much else to really talk about, to very, very severe, where they get big nodules on the backs of their pasterns and their fetlocks. They get chronic weeping, dermatitis, not just on the pasterns, but I've seen it on the fronts of the hocks, on the backs of the knees. So it can be mild and quite manageable to quite severe.
Okay, we've got another question here. I've got one here from Scott Kellenhofer. Maybe not necessarily a question, but a comment. Scott, can you hear us?
Oh, you want me to? Can you hear me?
Yes, go right ahead.
Sorry. Kathy, maybe you want to mention the success that we've had with that Listerine dilute that we've been spraying on the horses. It's just, and I know there's probably dozens of different home remedies, but when you look at one of our horses in particular and how he's made a huge turnaround after we started that application, that might be just an easy way to go for some people. You want to mention that?
Yeah, so in the idea of trying everything, we have tried just a diluted Listerine solution on one particular horse. And when he came to us, he had some real issues with his legs. His overall health is better. He's an active working horse. So we've done a lot of those management things to help him along. But for his daily management, we... Oh, can you hear me okay?
Yeah, I'm sorry. So somehow we got cut off there for just a second.
Yeah. So what we've done with this particular horse is we do curry his legs completely 3 days a week. We make sure that anything that looks like thickened skin that can be easily gotten off the surface of the skin, we take that off. And then we spray this dilute Listerine solution on his legs 3 days a week. And for him, for whatever reason, that has really seemed to help him. I think it goes hand in hand with the three days a week of pretty intense care on his legs and the management changes. But for him, that works. So, that I guess is where tailoring the therapy to each individual horse really comes in. You try multiple things until you stumble upon what works, and then you go with it.
Okay, I've got one more question for this round, and it's from Beth Maitland. Let's see, Beth, can you hear us okay?
I can. Hi.
Hi, Beth.
Hi, Dr. Kathy. I was just curious, does CPL impact over the long term? Does it impact the length of life of Friesians affected or horses in general affected?
It doesn't seem to. So from the standpoint of, well, okay, so if you look at the Belgians, for example, there are some horses that are so severely affected that unfortunately they end up being euthanized. So does it impact longevity? Yes. Maybe perhaps not in the way that you might think, but you begin to look at those horses and think, that's just not a good quality of life.
Yes,
So in the Friesian breed, because they seem to be somewhat less severely affected, you know, we can count our blessings there. But there has been a horse that, you know, really struggled with it and became an issue for him. How it played into, you know, his longevity, I don't have a clear picture of, but I do believe for him it began to be a real issue in his daily quality of life. But that is honestly, you know, one out of I don't know how many folks I've talked to about their Friesians that have it. So, you know, I think that we're lucky in that it's not going to necessarily impact the longevity in our breed like it might in others.
Okay, Dr. Fox, I've got just one more quick question here, and I'm just going to go ahead and read it. And it says, is this the Listerine with or without alcohol?
It is Joe Generic Listerine. It's the original Listerine, but it's diluted. So it is with the alcohol, but I dilute it roughly 50-50. So, you know, and that brings up a really good point. So if I were to use that on a horse that had open, you know, painful wounds, I don't think that would be a good thing. So I would stay away from it, and I would choose a different topical until I got that horse healed up. But I think the reason the Listerine is successful on our particular horse is because he doesn't have any open wounds, and what it does is just mildly disinfect and keep the skin a little bit drier, and doesn't allow that moisture to get in there and compromise the skin. So that's a really good point.
Okay, I think it's safe to say we can continue on.
Okay, so I'm hoping this video will play. This is a woman that I met at the Stallion Show, and she had actually contacted me a few weeks prior to that, and we agreed that we would meet at the Stallion Show and talk a little bit about her horse. What her horse suffered from was aortic rupture, and this is a problem in the Friesian breed that statistically doesn't happen really often, but when it does, it is quite dramatic and very devastating. When I met her, and as she outlined what was going on with her horse, it became very apparent to me that her mare Ishka was suffering from the chronic form of aortic, what they call aortic fistulation. And she made a video on YouTube in which she sort of chronicled her journey with Ishka, from the presentation of symptoms to having to say goodbye to her. And so I just put a little bit of this video on here to give you a little idea of what she says. So I'm going to see if I can get this video, to play here. I don't know if the volume is such that you can hear it.
It is playing, but it is hard to hear, and
Yeah, I don't know why the volume just doesn't seem to want to.
and I've had issues with the system with the volume videos as well. So it's not anything new.
Okay. Well, then you know what? What we're going to do is we're just going to talk a little bit about her. So, I would really recommend that all of you who are interested in this or potentially think this might be an issue for your horse, or just really want to hear it in an owner's language, what this looked like to her and to her horse, to go on YouTube and watch this video. It is well worth viewing. It is heartbreaking and informative and sad and all those things all at one time. So it's well worth watching. So we're going to talk a little bit about aortic rupture. Aortic rupture occurs in humans, for example, It also occurs in other breeds of horses. So probably, you know, I don't know how many people have viewed that video, that warm blood, I think it was, it went over the jump and then basically came down and died right there in the arena, right there in the stadium. And so it isn't an unheard of phenomena in other species. And we know a little bit more about it in humans. We know that in humans the aorta ruptures in the thoracic portion of it. It's a rarely fatal spontaneous rupture. There's oftentimes not an aneurysm that forms, and it's usually due to changes in the blood vessels themselves that can cause the aortic rupture. But in horses, it's a little bit different. It's in general, in other breeds of horses, it tends to happen in what we call the aortic root, and the ruptures close to the base of the aorta leads to acute cardiac failure and very rapid death. And if you look at who is the most common player in that, it's breeding stallions greater than 15 years of age. They really have no abnormalities. And you hear about that stallion that goes to breed a mare and then suddenly comes off that mare, lays down and dies. And so that and the stadium horse are typically what most people have in their mind when they think about aortic rupture in the horse. Little bit different in Friesians, and Dr. De La Salle's group, along with the folks at Wolvega, have been doing a lot of work on aortic rupture. Who are the horses that have aortic rupture? What do they look like? How do they present? What's their average age and gender? And they basically looked at the cases of aortic rupture that came through Wolvega and through Utrecht. So as they looked over all their cases, they looked at a case history and tried to sort of figure out who were these horses. What they found is there wasn't really any gender that was more likely to be affected than others. The mean age was 4.9 years. 3 out of 31 cases were found, and I'm sorry, it's supposed to be, were found dead without any prior symptoms, meaning acute death. Walked out in the pasture and unfortunately found them. But over a third of all the cases in the days and weeks prior to the cardiac failure did show symptoms. Things like recurrent colic, coughing and dyspnea, where they can't breathe, they're breathing quite quickly or not breathing as well as you would expect. Poor performance, anorexia, just not eating well, depression, not themselves, and epistaxis, which means bleeding through a nostril. Other things that became apparent and in 1 to 2 weeks prior to the cardiac failure was peripheral edema. So the edema that you see, that thickening along their lower abdomen, sometimes the edema would come and go. Sometimes it would be also on their hind limbs, for example. So it might be there one day and gone the next day. It might come and stay and worsen. Fever, again, intermittent fever, sometimes quite high. The fever might stay, you treat it and it goes away, and then potentially comes back, and you can't find another reason for the fever. And then what we call sinus tachycardia, sustained sinus tachycardia at rest, meaning a high heart rate even when the horse was standing there, that persisted. On clinical exam of these horses, increased body temperature when taken rectally, and increased jugular pulse. And you see in that picture, I think most of us, or I hope most of us, know where the jugular groove is on the horse's neck. That's where we take blood, for example, when you're doing a Coggins, from the jugular vein. A jugular pulse in a horse, a normal horse, is just a phenomenon that we see as a horse is standing there, in which the blood is pushed up through that jugular vein. But in a normal horse, you may see it intermittently, and it'll never go past about 1/3 of the way up the neck. That's from the chest upwards towards the head. So it's not unusual to see it, but it never should go any further than about 1/3. In these horses, you see a jugular pulse that is increased and moves much further up the neck towards the head. Pale mucous membrane, so you look at their gums and they seem abnormally pale. Arterial pulses. When you put your hands there and feel the arterial pulse, it is quite significant. That edema again. Interestingly enough, the arrhythmias. So if you were to listen to the heart, you wouldn't hear an irregular heartbeat or an arrhythmia. So they'll stay in normal rhythm, which is something that, as I've talked to veterinarians who are dealing with these horses, they find very interesting. They're looking for an arrhythmia, and when it isn't there, it is kind of curious. But again, we don't often see that as a part of aortic rupture. And then again, the sustained high heart rate, murmurs are not uncommon because the heart begins to work very hard. So it isn't uncommon to hear a murmur in a horse in this chronic form of aortic rupture. And I apologize for the pictures if they're a little graphic, but these do show the areas on these hearts where they're ruptured and how dramatic it can be. So I probably should have given you a little bit of a warning, but I think it's worth seeing these pictures. When they looked at those aortas and took samples and stained them with special stains, they noticed quite a bit of difference between a normal aorta and the aorta from a horse that had a rupture. So if you look at the pictures, and I think the pictures always tell the story better than the words, you look at the normal collagen on the left and down there in the corner, and it looks organized and linear and more sort of symmetrical. When you look at the collagen in the affected aorta on the right, it looks very disorganized. You don't see a nice linear pattern. It doesn't have any real structure to it. And it should have that normal structure that you kind of see at the top. So, you know, I have sort of listed from from the paper sort of what they saw on histopath. And the reason I did that, again, is if your veterinarians are interested in finding out a little bit more about this, then this is something that they would look at and read and go, okay, you know, that kind of makes sense. I kind of get where this is going. Sometimes even in the paper, it gets a little bit, I wouldn't say it's almost like reading Russian, but sometimes it is. But I think these are the big points that we should all pull out and get familiar with. That this fibrosis and inflammation and thickening and abnormal collagen are all a part of these aortas when we take them out and look at them on a histopathology slide. The good news is this research continues to move forward. And Dr. De La Salle and her team, again, have developed this new technique. And I did talk a bit about this on the Advocate as well, on the Foundation's Facebook page. And when she was describing this technique to me, I thought, oh my gosh, this is elegant in its simplicity. And I say that with a smile because simplicity is sort of a relative term. But when I think about anatomy, when you think about how the esophagus you can pass a clear stomach tube with a probe in it down the esophagus, and because of the way the esophagus aligns and near the heart, and specifically at the area of the aorta that we look at, and that we can take that probe and look at the heart and look at the aorta through that clear nasogastric tube and through the esophagus, I think that's pretty amazing. They've used this test quite reliably. They've used it in unsedated standing horses, and they've had really good success identifying those horses that have some issues and they're seeing some changes in the aorta, and being able to identify these horses and say, okay, you know, this is what's going on here. Your horse has chronic aortic issues. And so as they look at these horses, collect samples, collect DNA, she sort of reassured us that really a genetic test is on the horizon, and it may be available to us in as little as 1 to 2 years. And I think that's pretty phenomenal. So my hope would be that we can get her here at some point to show some of the veterinarians here in North America how to really do this diagnostic technique, and then that we also will be having a genetic test that will be reliable so we can identify those horses at risk. There may not, or there isn't yet, a way to treat this, but I think knowledge is power, and I think if you know your horse is carrying a gene and may be prone to this, it allows you to make some decisions for that horse in the long run. And so being aware of something allows you to make good choices. So that is really a quick look at aortic rupture. Are there any questions with that?
Well, let's see here. I've got Claudia Rainier, and I think we had some. I'm going to go ahead and read this here. It says, are these changes visible on any other arterial vessels other than the aorta?
That's a very good question, because when we start talking about elastin and collagen, and we start looking at not just the aortic rupture, but let's look at CPL. Let's look at, and I'm going to get to DSLD and some of these other things. One has to wonder, and it's more likely is not, that these things are all connected. So if we were to go and look at other blood vessels in the horse, we may very well find that this is affecting some of these other vessels. To my knowledge, it hasn't been looked at, but that doesn't mean it isn't there.
Okay. I don't have any other questions at this time.
Okay.
Claudia does say thank you for answering her question.
Oh, well, you're very welcome. Okay, so now I'm just going to do, and I know that probably most everybody's aware of this, but I think it's also important that we include the things that are coming from the KFPS and some of the things they're working on over there at Ghent and Utrecht. So I think we're all aware now that there are tests available for dwarfism and hydrocephalus. So I'm not going to dwell on this too much. There's a lot of good information on the web, both from FANA, from the KFPS, about this. So the hydrocephalus test, really quite good. Dwarfism, you know, we're going to work, they're continuing to work on that. So I believe that those tests will be finessed and become very good, reliable tests. So I don't know that I'm going to spend just a lot of time on that. But hydrocephalus, and again, kind of a graphic slide, and it's difficult, I think, for us to look at that. It's sad for the owners. You know, I think about these foals that are born, and I think how devastating it is for an owner because you've waited so long for this foal, and this is what is delivered to you. It's difficult for the mare to deliver these foals sometimes, and it's lethal. So the genetic test is accurate, and really we should use this test. We should be testing stallions and mares because we have to recognize that there is a genetic contribution from both, and we need to identify who is carrying it and use this information, not to exclude bloodlines, not to exclude breeding individuals from our gene pool, but to breed more responsibly so that hopefully none of us have to endure that anymore. Dwarfism. Again, the genetic test is available. I'm just wanted to show this slide so you could see a little bit about what a normal carrier looks like a normal horse. A dwarf is quite a different story. So phenotypically quite different. So I'm going to move to DSLD. I've had a lot of interest lately in this, and it makes me, again, pushes me to revisit this a little bit and say, okay, where are we at with this? How does the Friesian fit in? And what can we do now to push this forward with our breed? So DSLD stands for degenerative suspensory ligament desmitis. It's a chronic progressive condition that affects the suspensory ligament. And I'm hoping that most everybody knows what structure I'm talking about, but the suspensory is that ligament that's tucked up right behind and adheres to the cannon bone, runs down over the fetlock and attaches down back on the pastern. It is a support structure, and you can see from this horse that when that support is lost, the typical things that you can see is that very extremely dropped fetlock. It can affect the front legs, the hind legs, or all four. And there's been a lot of research done with other breeds to determine the cause. Peruvians and Pasafinos are really significantly affected with this. A lot of work being done with those breeds. But we also see it, and sometimes I think for different reasons, in quarter horses, for example, as well as our Friesians. Even in these other breeds in which there's been a lot of work done, to my knowledge, even though they recognize that there's a genetic component, there's no genetic test for those horses to date, to my knowledge. So again, you know, in kind of getting out there and looking what was out there, I emailed a researcher, Dr. Halper, because she was doing some work on this very issue in Peruvians and Pasafinos. And we had a really good discussion about Friesians and how they fit and where they fit. And is it the same? Is it different? There was a little bit of a feeler about expanding this project to include Friesians. But there's only just so much time and so much funds. So I keep in touch with her. She's doing a lot of great work down there, and I really think at some point, hopefully, we'll get those Friesians in on her study somehow. But one of the things that they talked about is that DSLD is a disease process previously thought to be limited to the suspensories, but is in fact a systemic disorder involving tissues and organs with significant connective tissue component. And that was probably the statement that interested me the most, because I believe that we are going to find this with the Friesian horse as well. The importance of this is that many breeds suffer from this disease. But the other thing that was so interesting to me is it has been connected in Peruvian Pasos to cardiac issues. And can this connection be made in the Friesian horse? Sure makes me wonder. So I always read that slide and I think that's things that make you go, So this is my motivation for keeping in touch with them, watching what they're doing, and then potentially, hopefully, we can bring the Friesians in on their study, piggyback on it, look at what they've learned, and hopefully identify this a little bit quicker in our Friesians. And I'm just going to kind of leave that there unless there are any questions so I can cover a few more things before I wrap it up. Were there any questions at all, Jason?
No questions to that section.
Okay, then we're going to kind of keep moving through. Corneal dystrophy is something that is relatively newly recognized in the Friesian horse, written up last year by a group at UC Davis. And their objective was to describe the clinical presentation, treatment, and outcome of corneal dystrophy in Friesian horses, analyze their pedigrees, and investigate the heritability. So within their study, they had 9 Friesians that had corneal disease in both eyes. And they did what's called a retrospective study. So they looked back and reviewed the medical records, looking for similarities, differences, age, location, what the corneal lesion looked like, what kind of surgery was undertaken, did it work, and what was the outcome. And the results were the average age at diagnosis of the first eye at their study was 10.7 years. Males affected more often than females. The corneal lesions, so these lesions on their eye, were inferior in location, meaning lower half of the eye. Average size about 5 millimeters. The depth, that was interesting. Some were very superficial, so just the very uppermost, outermost layers of the corneal to complete full thickness perforation. So the cornea was completely compromised, and those horses actually had portions of the inner part of their eye come through and perforate. So again, mild to quite severe. All affected horses shared a common ancestor back within 6 generations. The identification of that ancestor is not released to my knowledge. They're still working on this study. So this study is actually expanded. We have been in contact with them and are going to move some cases that I know of in their general direction. As they get more and more information and work on a genetic test, that is their goal, then potentially they will be able to have a test animals for it, and then release the results. So of their treatments, 8 of 9 perforations were surgically repaired, with 7 of 8 retaining vision. 9 of 9 non-perforated treated eyes remain visual. I think that's really important to recognize, that even though this is something that you kind of go, oh, here's one more thing, this is something that we can really impact in a positive way, treat, and have a good outcome. So I think it is important that we continue to work on this, not only because we want to sort of figure out genetically where this is coming from, but the more we know about it, the more we will be able to positively impact them through medical and surgical treatment. I think that's really an important thing to keep in the front of our mind. Okay, I'm going to move from that, and I guess I'm going to put a little plug out there. Anybody listening who's had any of those corneal lesions, if you want to contact me and share your case, I'd be very, very interested in hearing about it, and then potentially with of course your consent, moving that case onto and forward it onto the folks at UC Davis to get you in that study. So I'll put a little plug in there. Any questions at all?
I've got one here. If your Friesian has had OCD surgery, does he then have more of a chance to have DSLD?
No, not to my knowledge. Which is a good thing to know.
Okay, that's the only question I had at this time.
Okay. All right, so I'm going to move on a little bit again, shift gears again. We're going to talk about IBH, insect bite hypersensitivity. And I think this is really important to touch on because it's that time of year. So probably in the last couple of weeks, I've had 3 or 4 contacts about this very subject. It's been termed sweet itch, seasonal allergic dermatitis, and it does tend to be seasonal, generally not life-threatening, but I'm going to tell you it's very, very uncomfortable for the horse. Severe itching, skin lesions, manes and tails really damaged. And so it can be quite a problem for those horses that are affected. Currently, there's no treatment to cure this per se. So we really work on prevention of symptoms. Sprays, sheets, stabling them at the times when insects are at their most vicious, which is dawn and dusk. This time of year right now, for us in Wisconsin, it's kind of, we're ramping right up with insects, mosquitoes. We don't quite have the no-see-ums yet, but they're coming. So it is a time of year to really talk about this and really think about this, because you want to get ahead of it before your horse really begins to suffer from it. Medication. Topical steroids topical steroids and also systemic steroids are used, antihistamines, oral antihistamines are used, but they have limited effectiveness, and why that is has not really been worked out. When you look at other breeds of horse that get hives, for example, or run into the mosquitoes and they are head to tail hives and they're itchy, and you give those horses a dose of steroids, it brings them a great deal of relief, to the point where within a matter of hours they are so much better. These horses don't seem to be that way. And so while it is, in my opinion, good to try to treat them, especially topically, to just try to bring them some relief, we really have to be in there with our management, because we're not going to be able to rely on medication to get them comfortable. This is one of those things that it can be very expensive for owners to treat. I've had owners talk to me about the 6 or 8 different types of fly sheets and masks and that they've tried for their horses. The medications, the topicals, the sprays, the shampoos, Then all the changes they make to the stalls, the fans, the misters, the list goes on. So it can be very expensive and very hands-on, very time-consuming. When your horse looks like these horses, it does decrease the value of your horse, and honestly, it impacts the quality of your horse's life. There's a lot of research going on in this, and not just because it's Friesians, but Icelandic horses are also quite severely affected. And we think that one of the reasons is when you look at Icelandics, for example, and you look at where they came from and the type of environment that they evolved from, insects were not a huge part of their life. You bring these horses where they didn't have all that natural exposure and the building of immunity, natural immunity, their whole, for generations and generations, and you take that horse out of their environment and put them here in Wisconsin, for example, where we do have lots of bugs, we do have culicoides, and suddenly they have to contend with them. Their immune system has to contend with that. We think that that factors into it. We really believe that that potentially is why Icelandics and even our Friesians seem to have such an overwhelming immune response to something that, say, the quarter horse standing next door doesn't seem to have such an immune response statistically. We do have other light breed horses that do have significant sweet itch, we call it. But again, they seem to be more easily managed with steroids than what we are seeing with our Icelandics and our Friesians. So what is being done for IBH? There is a lot of work and research being done, not just on defining exactly what it is about the culicoides in particular that causes such a response, but there's also, and I meant to put this paper on here as well, that I recently, in the Advocate, there's another group working at a vaccination, quote-unquote vaccination for this. So we're not only looking at what it is about that insect, by what protein is it, what is it about the culicoides bite that is causing such a huge response, but how can we use vaccine technology to get in the way of that and help the horse cope better. So you've got some folks in the Netherlands, and then you've got quite an active group working with the Icelandics. They cloned proteins found in the culicoides, and they believe those cloned proteins will help researchers get enough and collect enough of these allergens to develop immunotherapy, specific protocols to treat this disease by injecting and repeatedly these allergens until the horse's sensitivities decrease. So we're familiar with that type of thing in humans, for example, in dogs, for example, and I think we're a little bit closer to getting there for the IBH horses that are currently suffering from this here in the U.S. But how do we help these horses now? So this is an example of a sweet itch blanket. Very form-fitting, very, very fine mesh that for some horses is very, very successfully kept them from getting those terrible symptoms that we see from IBH. Now, some horses will wear these things and some horses won't, and I have stories about horses spending an inordinate amount of time trying to get out of that. They don't like them, they sweat under them, they're uncomfortable. And so this is one example of any one of probably a dozen that are out there, but it is one that I've had anecdotally people tell me they've used successfully. The other product that I have used is by Kinetic, called EquiShield, and they developed a line of skincare products specifically for horses. I had a talk with these folks at the AEP one year, and they're very interested in developing some things that can help these horses cope with that itchiness better. And both of these products I've used on not just Friesian horses but other horses, and used successfully. So that is something I can tell you does seem to bring some relief. If you go online, type in Kinetic equine skincare products, you'll see their whole line. I believe these are still only available through your veterinarian, but they're easily accessible through many veterinary distributors, and it's well worth giving them a try. These folks at Kinetic have really worked hard to develop something, are interested not only in us using it, but also our input back to them into how they're working. So we've had some pretty good luck with that. But the good news is, again, people are working hard to try to solve this problem. It seems as though they're really honing in on what we need to do. So I'm hoping, again, in that 1 to 2 year time frame, we'll have a really effective way of bringing these horses some real relief. Okay, so that's, I guess, on those things, unless there's any questions, we're going to shift a little bit again.
Okay.
Any questions?
Yep, I do have a couple questions here. One from Michelle Swigert. Michelle, can you hear us?
Yeah, can you hear me?
Yeah, would you like to go ahead and ask your question?
Hi, Michelle.
Well, hi, how are you? Hey, it's just a product put on like you do the drops of Frontline for a dog, and I've used it a couple times now, and it's been amazing. But I was concerned about it on a pregnant mare.
Okay, what is it that you're using?
It's called EquiSpot, I think.
Yeah.
I wrote it down. I had to Google it.
Yep,
and you
I'm
put
familiar.
Yeah, what do you think about that? Because it really has stopped all fly bites on my horses that I've used it on.
And again, you know, I've had some people tell me they've had very, very good luck with it, and other folks not so much so. So I always keep things like that in the arsenal and say give them a try. And because, you know, really EquiSpot is not, it's actually quite reasonably priced. And so
Yeah,
it is worth trying. Absolutely worth trying.
Yeah, it's like a couple bucks for every 2 weeks.
Yeah.
But I've had excellent luck because I have a couple horses that are allergic to every fly bite.
Yep. So again, you put that in the arsenal of things to try. So anybody who has a horse that is struggling with this, add that to your list of potential.
What do you think about for a pregnant mare, though? It doesn't say that.
Well, you know, that's interesting because a lot of products out there, when they go through the testing, they don't want to necessarily test it specifically on pregnant mares because it costs just a ridiculous amount of money to get that disclaimer. What I usually recommend you do is call the company and get their take on it, and I'm probably going to do that as well. There are dewormers, for example, that are not labeled for use in pregnant mares, but they're completely safe in pregnant mares. And there's anti-inflammatories that are, again, not labeled for use, but are completely safe and used every day. So this would be a product, before I put it on a pregnant mare, I'd want to be sure that that they're feeling like, yeah, it's going to be fine, it's not a problem. So definitely check it out with the company.
Okay, thank you.
Okay.
Okay, next question here. I'm going to move up here to Jennifer St. Germain. Let me get her unmuted here. Jennifer, are you there?
I am.
Okay.
Hi, Jennifer.
Hi, how are you?
I'm good.
I have a question. My mare actually has a spot just right on the top of her withers that I'm having a problem with. She twitches really bad. It's very uncomfortable for her. Is it normal for it to just affect that tiny little area? She's never had an issue before.
So when you say a spot, is it like a wound, an open weeping wound, or is it just a hairless area, or what is it?
It's not even hairless. It's more like when she allows me to touch it, it almost feels like tiny little bumps under the skin. She was on 10 days of antibiotics. She's still on the prednisone right now, and I thought she was getting better, and it went right back to where it was when I first called the vet out. And it's nowhere else on her body, just on the top of her withers where the neck comes down.
Sure. Well, that's a new one for me. I'm going to say, though, that, you know, whenever you have something really focal like that, the question is whether it is something, I mean, you begin to look at, okay, for example, blankets, saddle pads, tack. You look at anything that sits there or anything that you spray on topically, anything that's a contact problem. So you want to rule that out. If you get to the point, though, where it continues to recur, then you're almost left with having to skin biopsy it because you want to make sure that you're treating it correctly. I mean, that's the most difficult part is that you treat something, but if you're not treating it correctly, then the question becomes, did your therapy not work because it was the wrong therapy? You weren't treating the right thing. You need to go in a different direction. So, without maybe what you could do is just send me a picture of it. Just email that to me, and
Okay.
and then I can look at it and go, And I don't know whether I'll have anything more to add, but that's sort of a new one for me.
I really appreciate it. I'm kind of frustrated. I can't ride her. I can't put a surcingle on her.
Yeah.
It rains across it. She twitches so bad. She crow hopped on me to get me off. It hurts.
Send me a picture and send me a little history and let me know what you've been doing and let me just get a look at it and maybe I'll have something to add.
Okay, I really appreciate it. Thank you.
Hey, no problem.
Okay, we can go ahead and move on.
Okay, so we talk about a lot of things with this breed of horse, and some of them have been talked about a lot. Some are things that I go, that's interesting, and I put a little search out there and I don't see much out there. So these are other things that I ponder that I'm going to throw out there, and hopefully either you'll see them on the Advocate or you'll see them in a presentation somewhere that'll be a follow-up. But these are things that make me kind of go, gastric rupture. I'm always interested at how within the Friesian breed that comes up not infrequently, but I'm disappointed at how little research data is out there. Today I had some time, and so I thought, well, I'll go on any one of a dozen search or sites and places where I look for research and see if there's anything new. And honestly, there's case studies written out there that I do not find any research. Things like histopathology, like we look at with the aorta, or retrospective studies that we see with some of the other megaesophagus and corneal dystrophy. There's just not much out there, and I ask myself why that is. It's something that we in this breed are concerned about, and so it may be something that we begin to, with your help, collect more data on. Which horses do this? What is it about them? How old are they? Was there any complications or any factors that led up to it? And maybe if we pull enough cases together, and I'm talking about good, solid medical records and things, maybe we can put it in front of somebody and get somebody interested in doing a little research, because there's not much out there. So, all you folks out there, talk to your friends. I know that you know horses and people who have gone through this with their Friesians. Let's see if we can't put something together. So that's kind of hanging out there. New bit of research, axial osteitis of the sesamoid bone. This is a new thing that was very recent. Got the paper in front of me. You're going to see this, as I said, it's advocate worthy. So you're going to see this on the Friesian Advocate. Interesting from the standpoint of looking at lameness in the Friesian. I think there's more needs to be done with this. When we start talking about hind limb lameness, this is something that you folks out there who are dealing with that a little bit with your Friesians might find it interesting. So there's a group out there looking at this. Pretty interesting stuff. Stay tuned because you'll see it on the Advocate. Laminitis. I had a researcher from Europe send me a little feeler, and he was looking at, interestingly enough, laminitis in cattle. And he was looking at cattle, Friesian cattle, and looking at soil and feed and all kinds of things in relationship to that particular breed of cattle. And it got him pondering, because he has Friesians, about laminitis in Friesian horses and whether their soil and their environment and their climate makes them what he feels to be less prone to laminitis. And he put together enough cases, enough interest, that it looks as though a research project is going to come from that. So he sort of put it out there to me and said, you know, what are you seeing from your side of the pond? Um, I've heard of laminitis and Friesians, and I'm not talking about laminitis that's due to a retained placenta or due to sickness, for example, but we're talking about maybe nutritionally motivated laminitis. And I don't hear about that often. So again, I put a little feeler out there to you guys and say, okay, you talk to your friends, you have horses of your own, you are on Facebook. Let's ponder this a little bit. Talk to me about your laminitis cases, and let's see if we can pull together enough information here, send it across the pond, and fuel that research, because he feels like he's onto something. He's got a lot of interest in it. It looks like it's going to be funded. So let's see if we can't help him out there. I think that would be really interesting. Anesthesia. Boy, that comes up quite often, and it's always a concern. But I ask myself, what is the real risk for Friesians? And the answer to that is depends really on who you ask. When you start surveying and talking to surgeons and anesthesiologists here in the United States, they feel a little bit of anxiety with the Friesians that end up on their surgery tables. And when you ask them if it's Friesians or if it's draft horses, or is it because they consider a Friesian a draft horse, you know, you sort of get a sort of yes, that's why. But when you talk to folks, and I put this question to several folks in the Netherlands, folks at Wolvega, for example, and I asked them how they feel about anesthesia and Friesians. They go, well, we treat them like we do any other horse. We treat them like the standardbred. We treat them like, you know, the thoroughbred. And I find it interesting that perhaps we here have a little different slant, and I'm not sure why. So that question is out there. And, you know, it's kind of one of those things that makes me go, So again, interested in what you guys are feeling out there, what your surgeons and anesthesiologists feel about your Friesians. And maybe this is something we put to rest, or maybe this is something that merits a closer look. I'm not sure. So, you know, we'll kind of see where that takes us. And one thing I forgot to put on here, but I think is really interesting, is these gait analysis studies that are being done. And gait analysis has been around for years and years and years. You see things from the early 70s. But they're using gait analysis technology now to look at the movement of our Friesian horses. And there was a study, and again, hopefully you'll see this on the Advocate, in which they attempted to say, how does gait analysis and the actual physical look by the Friesian judges and their assessment of motion, how do those two things really correlate? And it was almost thrown out there like, you know, we might use our gait analysis equipment and our computerized studies to help choose who potentially might be the best stallion candidates. And I found that immensely interesting. So that technology is out there. It's being used in a way in which kind of made me go, But what they did find, for the most part, was the gait analysis equipment and the judges' actual looks correlated very well for the walk and the trot. Little less tightly correlated for the canter. So look to the Advocate, and I'll put that on there and put a link on there and let you get a feel for that on your own. So that leads me to something else that is sort of near and dear to my heart. Are you reading the Friesian Advocate? And that's my weekly look at a piece of research. You can find it on the Foundation's website. And I said that, you know, is of interest to us. And, well, then I have to say, well, it's interesting to me anyway, because I pick the articles. Now, oftentimes I pick them based on suggestions from all of you. Sometimes I pick them because I go, wow, that's just really kind of fun or interesting. But what I try to do is pick an original research article, summarize it, and cite it so that you know where I got it and where it was published, along with any related companion articles coming from Equus, The Horse, Horse and Rider, other sources. I look at Friesian-specific topics as well as general equine topics that pertain to all of us, no matter what kind of horses we're talking about. And here's an example. This was this week's post. I asked a question. You know, myth or real? Is there more to retained placenta in a mare than simply a uterus that can't or won't respond to oxytocin? So I take that article, ask a question, or I phrase it in a way that I've been asked, and then I use that research to help answer the question. So I let the researchers tell us what they found out. So this is this week's, and this is how I phrase it. And then it always brings up really good discussion. We had a lot of really good points and a lot of good discussion. But I guess what I want us all to be reassured of and to think about is that, again, all over the world, all over, there are people working very hard to answer questions about our horses. And some of it is very Friesian specific. Some of it is, this is a little more draft horse sort of thing, but Friesians suffer from retained placentas. And some of it is just good information because you have 4 legs and knicker. So check out the Advocate. Give me your ideas of things you're thinking about or a question you're wondering if they've answered, or is there research, so that we can keep it going. I try to do a little part about why this is relevant to us, and then give you the citation where I found it. So check those things out. Here's a couple things that I just think were very interesting, and talk a little bit about research and how it pertains, again, not just to beautiful Anton here, but to all aged horses. Age is not a disease, and thankfully we as people, I'm happy to know that age is not a disease. They just looked at how old is old, and asked owners, how old is old? And they suggest that aging changes are seen at approximately 23 years of age. That greater than 16.5 years of age was considered a negative. That horse was considered older with a pre-purchase exam. And what that is telling me, that I remember when I was young, 12, a horse that was 12 seemed old. 15 seemed really old. But because our preventative care has gotten so much better, because we recognize diseases earlier, we can feed horses better and care for them better. Old now is greater than 16, and old age changes on average show up at 23. So I think it sums it up well at the bottom, that old age is the #1 cause of death in horses greater than 30 years of age. I think that's a really nice thing to know. Another one, and this is a fun one that I found, that combines technology and laminitis. So they had a mare in Australia that was, her name was Holly, very, very laminitic. Tried shoes, tried pads, tried combinations, couldn't find anything that fit and brought this horse relief. So they scanned her foot, took all these measurements, and 3D printed her a shoe. And when they put those shoes on her, she walked off the best she had ever walked off. It's like she breathed a sigh of relief and said, now we're talking. And I think that's very cool that we take technology and apply it in such a way to bring health and comfort to our horses. So cool things out there. And I'm going to end on a little bit of a lighter note here. You know, people ask all the time, why do we do all this? What motivates the foundation to do all the things that we are doing? These horses are what motivate us. And these are pictures of all the horses. Some I knew very personally. Others I didn't know, but were owned by all of you. And you would call and talk to me about them. And these, unfortunately, are all horses that are no longer with us. But these are the horses that motivate us to do better, so that we can get these a better, healthier horse who can stay with us longer. So it's good to remember. It's good to remember these horses. And here's just a list, again, of names of horses that push us to do what we do. The other part of the foundation and that has been very gratifying is our surrender program. So we've had horses that just needed to find a different spot. And our goal has been to, as I say, there's an owner for every horse and a horse for every owner. And the hard part is matching them up and finding that pair. But here's Duvesa with her new owners. So she found a wonderful home with two people who will care for her and hopefully have her for a very, very long time. Tessa went to a new home. It's owned by a photographer. So she's dressed and content in a pasture fit for a queen. Wishes spent a little bit of time in my backyard, and now he is in his new home, and he certainly couldn't have wished for a better home. Two people that love him and his own herd of ponies to run with. Layla, love at first sight. I think that picture says it all. And Brissa, this young woman always wanted to have a Friesian. Along came Brissa, made her dream come true. So a match made in heaven. Oriana, enjoying her new pasture. Short was an interesting horse, had a little bit of a disabling problem here that wasn't compatible with the snow and ice and cold of northern Wisconsin. So he found a new home with no snow. So he gets along much better and doesn't have to worry about falling on the ice. Zazu and her new owner, absolutely pretty as a picture. So the other thing, you know, are horses that have gone, are surrender horses, but also all of these other horses that teach us, that teach our kids, that go to schools and teach kids about not just Friesians, but about horses, that go to exhibitions and introduce youngsters to the kindness and sweetness that this breed has. But we also do it for all of you who love your Friesians and do all these amazing things with them every day. We love our Friesians. We know how much you love them. And I'm going to end with this video. You know, being with the foundation as a veterinarian has been an amazing experience for me. I don't come from a Friesian background, but the horses and all of you have been amazing, wonderful teachers for me. But this, to me, is one of the real perks of what I do. That was a video from the first time I ever attended the Stallion Show, and I was amazed and awestruck, and if I wasn't already in love with them, I certainly was after that. So I'm going to end it here. This is a little piece of artwork that my daughter did when she was very, very young, and this is another thing that always brings a smile to my face. So thank you, everybody. Is there any more questions?
Yeah, we do have a few questions here.
Okay.
Let's see, I've got Valerie, I apologize if I'm going to probably pronounce your last name incorrectly, but Valerie Sibus has got a question for you. Valerie, can you hear us?
Hello?
Hi, Valerie.
Hi, can you hear me?
I can.
Awesome. I was asking a question regarding a pill cam capsule that it's been made by Given Imaging for humans, and it has been approved for the FDA. And what the pill cam capsule does, it's a camera that takes 18 images per second.
Yeah, I am familiar with that. Yeah.
And I actually went with a doctor from Given Imaging, Dr. David Mason, and he and I did a presentation to Dr. Eric Mueller over at UGA, and he was quite interested, but they didn't have the funding. And I was just wondering if you thought that it would be something that might be beneficial to Friesians, because we're trying to modify the PillCam capsule with LED lights to try to study and see about the colic and see if there's any predisposition for the gastric ruptures. Is that something you think might be good to do for Friesians? Is to they just swallow the PillCam capsule?
Yeah, I've actually seen some of the footage from those that when you think about stuff like that, certainly that's one of those things where my response to you would be potentially yes, but what I would want is more information. So how does this work? How is it? How could we get to where, get that camera to potentially where we think the stomach, ruptures. So that's all things that I go, yeah, there's limitless potential out there. I just don't know enough about it to logistically know how it works. So that would be something that maybe we could talk about, you and I personally, and put me in touch with this guy and explore it. Why not? It's fascinating technology.
Okay, and thank you so much. And may I ask another brief question?
Sure.
I have a Friesian that's 9, and but I've had horses previously that have lived till 30, and when they became older, we gave them turmeric powder. I'm all for the natural things that help these horses. Now, this was not a Friesian, it was a Belgian. But would it help with Friesians, and at what age might it help to start giving the turmeric? Now, we gave it to this older horse, and we did a study with many horses, and I'm not a vet, but I was just involved with, I'm very interested and have been involved with rescue horses and different horse breeds, but I happen to have a Friesian of my own and wonder if I should be giving him turmeric, because in these other horses, when they got older, it was helping with their bones and joints, and seemed to really help them a lot.
I don't even know necessarily how to answer that, because to my knowledge, I've not seen any good retrospective type study. And that's almost, to answer that question, you got your clinical impression. That's what I call it. So you give something like that to a horse and you say, my experience has been that an older horse benefits from this over this time span of its life, okay? And so that's clinical impression, and that's valuable. There are a lot of treatments that are done because we clinically know they work. There might not be a lot of research or data out there to support it. So I know that turmeric is used as an anti-inflammatory, used quite successfully. I don't know if there's a downside to long-term use. So those would be the questions I'd be asking myself: is there any data out there to support its use, yes or no? How did they use it? And is there any long-term negative effect to giving it to a horse? And if the question is yes, it does help them, and no, there's no long-term effect, then potentially, I suppose, you could begin to give it to them, much as you would, say, some of your joint supplements, some of your nutritional supplements that you give as a horse ages, because we just know that joints are subject to wear and tear, that older horses don't digest as efficiently, as effectively as a younger horse. And so, at some point, your horse moves from middle age to older, and that tends to be when we put them on some additional supplements. So I'm thinking off the top of my head, that might be when you would put a horse like that on it, provided, like I said, there's no negative effect to long-term use.
Well, thank you so much.
Does that make sense?
Yes, ma'am, and thank you so much. I greatly appreciate it.
You're very welcome.
Dr. Fox, Michelle Swigert would like to know, she's been looking for this powder, and she'd like to know where she can purchase that at. Looking for what? The powder.
Which powder?
I'm not. She didn't say. So let me. She says the turmeric powder.
Oh, you know what? You can get that. You can buy that bulk and most times they buy it online. Dr. Krista Porter helped me find a bulk source of it. So if you can't find it, I can ask Krista again too.
Okay, we've got just a couple other questions here. I'm going to go to Ann Merchant. Ann, can you hear us?
Yes, thank you. Yes, I was wondering whether there are practices that breeders can adopt to help prevent the development of these genetic diseases. Do we need to see more outcrossing, less line breeding? You know, what can we do to prevent these things from happening?
Well, I guess the ultimate answer is that, in my very humble opinion, would be to work with the genetic tests that are available, test your horses as more tests become available, and then ask that same question potentially, and let's just say you have the mare and you've tested your mare and you know exactly genetically what genes she does have and does not have, what she's a carrier for, what she's not a carrier for. And you ask that same question potentially the stallion that you'd like to breed her to, and then attempt to, within the breeding program that you are following. So you attempt to then make the best match that you can to minimize the genetic issue. And I am not trying to avoid the question. I'm just saying, you know, whether you want to outcross or line breed, to me it becomes more a matter of breeding responsibly based on what you know to be true about the genetics of sire and dam.
Thank you.
Okay, we've got another question here from Lisa Musselwhite. Let me go to Lisa. Lisa, can you hear us okay?
I can hear you. Can you hear me?
Yes, go ahead.
Hi, Lisa.
Hi.
Go ahead with your question, Lisa.
Yes, my question, I just have two questions. I was just wondering if you've had any more reports of horses, Friesians, having OCD lesions? And
Yeah.
Catherine, I know that you've talked to me extensively about this.
Yep, and yes. Unfortunately, yes. We do have osteochondrosis to deal with in the Friesian breed.
Okay, so it is showing up. And then my other question is, are splints more common in Friesians?
You're talking about that uncomplicated splint. Yes. I would say no. Mm-mm. Okay. And it's interesting because, you know, to be honest, I myself have not encountered that many Friesians with splints. So I would say that they are definitely not more prone to it.
Okay. Then I guess
in my opinion.
Yeah. My Friesian mare got one when she went into training, and then her son also has a splint on each of his legs. So then my guess is going to be it's going to be more trainer in the training that they had than the breed. You know, and also if you, well, you know, we know in any breed of horse, the most likely time a horse will get a splint is when they enter training. And so you can make some, I don't know, I'm going to call them educated guesses, potentially, about why that's occurring. If you radiograph them, sometimes location helps you, but I'm going to say that I look not only at the training, but I also look really hard and make sure that that horse is training on very balanced feet. So, and I'm talking about hoof balance, I'm talking about good conformation. You know, I try to look for what I can that I can impact in a positive way or potentially change. So, because once the splint is there, it's there, and you can't change that. But what you can do is try to find what, if anything, you can change, make that horse better balanced, more comfortable, so that splint doesn't worsen and that you don't end up with a, you know, really large blemish. Yeah, that's actually what we're working on with Solana's son.
Yeah, so
we've done all of that. We've had an X-ray where his hooves are balanced, and he's in with a different trainer now, and things are going much better. But I just wondered that.
if it was common in Friesians. And somebody had mentioned that to me, and I said I didn't think so. And
No,
since you guys
no.
are here, I thought I'd ask.
Well, that's nice to know too, that that isn't something we worry about tremendously in the Frisian. One more good,
Yeah.
positive point for them.
Definitely, definitely. Well, thank you so much, you guys, for talking with everybody. This is awesome.
You're very welcome.
Yes, thank you.
Okay, and Dr. Fox, I've got one more question here.
Okay.
This is from Tracy. Tracy Venter. Let's get Tracy. Tracy, can you hear us? Tracy? But Tracy says, thank you for a very interesting webinar and for all your research. I picked up on a comment made by Catherine de la Salle in one of her presentations on aortic rupture, where she said the Friesian horse should have a higher copper content in the diet. I wondered if there was a recommended daily amount that may help with the collagen development, and if it has other benefits to Friesians in particular.
Wow, it's funny she should bring that up because I was just reading something about copper levels and the negative impacts of having too high a copper level. So I don't think I'm going to put an answer out there without looking at that a little bit more closely and seeing if there is an actual recommendation. The article I was reading did not make one. It was just exploring the pros and cons of too high and too low. So I've got that on my list of questions, and I will explore that. And I know Tracy, so I'll get back to her, but I'll also try to find some way to get that information out there. Maybe on the Advocate or something, I'll put a little blurb on there. So I'll follow up on that.
I have one more here that Scott says he can comment on the copper content. So, Scott, would you like to comment?
Yeah, Jason, we had a horse that we lost to aortic rupture, and when they did the necropsy and histopathology on the horse, they noted there was a deficiency in copper in the horse. And so we made the assumption that if we supplemented him, or if they had a higher copper intake, that would help the horse. And I don't think that was found to be helpful. Now, during Dr. De Bruin's report at the Fauna AGM in Seattle, he said that that they have found in the aortic ruptures that they've had in the Netherlands, they have found a deficiency in copper, but they didn't believe that that addition of copper would dramatically change the potential of a aortic rupture or collagen problem. So I think hopefully I've shed a little light on that.
I remember those comments as well. So I want to double check and make sure that I was understanding that correctly. But that is what I too remember from the conversation. So there's been a lot of talk about copper and its role in coat color, and its role. And the other thing we have to always remember too is that copper comes from food sources, and too much copper is not a good thing. So before we begin to supplement a single trace mineral like that, you have to really think carefully about what you're doing and what you've got coming in the horse's diet already. So I tend to I agree with what Scott has said, but I'm also going to follow up and make sure that we are all on the same page.
Terrific. That, Dr. Fox, that is all the questions that I have right now.
Okay.
I'd like to remind everybody, if you do think of questions a little bit later on, I apologize. My dog has been so quiet the entire evening. But if you have other questions, you can either email Dr. Fox or email us here at fauna@fauna.com, and we'd be happy to forward those questions. We appreciate everything that you and the foundation do, Dr. Fox, for this wonderful breed, and look forward to more information in the future. At this time, I remind everybody that the webinar has been recorded. We will be posting it on the Fauna YouTube station and on the website as well. So be looking for that if you'd like to review this a little bit later down the road. Dr. Fox, any closing comments?
No, I just thank everybody for taking the time out of their day to listen, and thank all these owners out there who take such good care of these wonderful horses.
Terrific, terrific. Well, thank you again for your time, and we look forward to future updates.
All right, you're very welcome.
Okay, have a great evening.
You too.